Okay, I'm checking my patient's orders, or my doctor's orders for the patient. Okay, it looks like it wants to verify that there's a primary line going of normal saline at 30 mils per hour continuously, and a secondary for vancomycin, 1,000 milligrams per 200 milliliters, IV piggyback over an hour and a half. This will be for my patient Steve Rogers, date of birth 12/25/2024. Alrighty, okay, I have my vancomycin here. Got the 1 gram or 1,000 milligrams here in the 200 milliliter bag. Alrighty, and I will go ahead and meet the patient and let them know and get started. Okay, hand hygiene. Hello, my name is Elise. I'm going to be your nurse today. Can I just verify with you your first and last name and your date of birth? Okay, first name is Steve Rogers. Date of birth is 12/25/2024. Wonderful. Okay, Steve. So today your doctor, Dr. Strange, wants to get started some IV piggyback for antibiotics. So just going to get some IV antibiotics in for you. We'll hook it up to your system that you already have going. I'm just going to assess your IV site before we get started. All right, your IV looks like it's clean, it's dry, there's no redness or swelling. It doesn't look like it's infiltrated. If it were infiltrated, I would stop the fluids, take out the IV, and restart it in a different location. But you do have IV fluids running. It looks like he already has the normal saline going at 30 mils per hour. So that's great, and it's flowing well, so it's nice and patent. Alrighty, I'm gonna go get everything ready for your antibiotic IV. Just before I get started, do you have any allergies to medications at all?
No.
Okay, wonderful. Well then I will go ahead and get started. Okay, I'm just gonna hand hygiene again before starting my IV antibiotics. I'm going to take this over to the side of the patient. So I'm going to clamp my line. Spike my bag. Slowly unclamp it while I prime. Oh, fill up the chamber first. Halfway. Then slowly unclamp while I prime. Try not to lose any of that antibiotic solution. Line is fully primed. There's no bubbles or anything. Okay. Now I'm going to hang my bag. Get out of the way. Hang my bag and then move my primary bag down. Okay. Before connecting, I'm going to pause the fluids currently going. Gonna grab a alcohol wipe. Going to clean both ends, both at the IV piggyback and on the primary line, for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Going to do the same to the line on the connection site on the primary, making sure that I don't contaminate the piggyback. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. I'm now gonna wait for both of these to dry. And for the sake of the pass-off, I'm going to assume that these are now dry. I will then connect the two. And I will unclamp. Now I'm going to program the pump. So channel select, we're gonna do a secondary, have my, go down to vancomycin. Just confirm with my orders while I'm going through this. We'll have vancomycin, it's 1,000 milligrams per 200 mLs. Alrighty, everything's looking good. It's 1,000 milligrams per 200 mLs. Okay, and then I have here, everything's looking good. I have my duration to be over 1.5 hours, just as the orders say. Volume to be infused is that 200 mils. We're now going to make sure that everything is unclamped and it can flow well. And I will start my infusion. Okay, everything looks like it's flowing nicely. Okay, Steve, we got that all set up. Hygiene. Just some things to keep in mind. So with this antibiotic solution, just in case if you do have an allergic reaction, look for signs such as any pain in your IV site, any like redness, itching, swelling at the IV site. If you notice like any kind of like redness or warmth in your face, yeah, and once again, the itching, anything that you like kind of shows like a allergic reaction, like those that I mentioned, I'm going to go ahead and press that call light, and I will come right on in here and we'll stop those IV fluids, the IV antibiotic. And then, yeah, if you notice any issues with your IV site, redness, swelling, pain, again, in the IV site, or if it's leaking anywhere, once again, press that call light and let me know. But other than that, you did great. I'm just gonna lower your bed, make sure that it is lowered and it looks like it's locked. Your side rails are up, your call light's within reach. I'm just gonna hand hygiene before I leave the room. I'm gonna go document. I'll be back in to check on you in a little bit.